Hello and welcome to Podiatry Practice Mastery. Don here. I want to talk today about my number one tip for streamlining content production. I've been producing content both on YouTube and like a podcast, actually 2 YouTube channels, just for a number of years, blog posting, things like that. And I just let me tell you what it used to be like. Basically, I had a lot of different ideas. I used to put them in Evernote. I used to put them in my Apple Notes section. I wrote them on papers. I had them in my notebook. I had them pretty much everywhere. I had different ideas where I had just a list of ideas, and nothing really ever worked for me, and I was never ever consistent with how to produce content. And then I started to use a topic that worked, kind of an area that worked really well. So what happened is everything was kind of mismanaged, and it was kind of all done random. So my number one tip for you, I know it's going to sound really simple, okay, because it is. It's using Google Slides. And so what I mean by Google Slides is I have one slide deck that says PPM, which is Podiatry Practice Mastery. And then I have one slide deck that says Dr. Pelto. And these are saved onto my Google browser. And my Google browser I'm logged into it in all 6 of my treatment rooms at both of my offices. Okay? So when I have those there, you're able to make use of any spare time you have to work on these ideas. And so I'll kind of explain what happened. So if I'm with a patient, like for example, I had a patient the other day, and she had a question about whether she needed to change her orthotics. And so she brought her orthotics and they looked fine. So what I do is I actually have my staff take a picture of them, of the orthotics, or if I'm talking about a wound, or if I'm looking at a fracture or anything like that. So the way I do it, if it's a wound, they'll take a picture, put it in the chart, and then I can open up the chart and I can take that picture, and there's no identifiers, and then I put that picture on a Google slide, right? There's no identifiers, so there's no HIPAA breach. And then I have one type of if you look at all my I call them thumbnails for all my videos, they're all pretty much the same. They're like a black font, a black in the back with a gold font and one picture. That's kind of how I make them. I borrowed that from someone else. So making them always consistently look the same. And I put that, and I kind of think of a title, and I put that in there. And then in the notes section of the Google Slides, that's where I wrote some of my notes of what I'm going to be saying when I record things. So I'll do that for Podiatry Practice Mastery. I'll do that for my other Dr. Pelto little videos. And I kind of curate throughout the week as I go. For example, if I see an x-ray that's kind of interesting, I'll do a screenshot. So there's an app called, I think it's called Clipper. It's within Windows, because we run Windows, and I can clip something from an x-ray, once again removing the identifiers if I want to teach something about a fracture or something else I see on the x-ray that I want to show patients about. And I'll put that, and I'll copy that, and I'll put it right into my Google Slides. And so these Google Slides I can open up on any of my screens. And so I'm doing this either while I'm seeing a patient, or I'm doing it right after seeing a patient, or I'm doing it like at my lunch hour. And I'll do these Google Slides, and then what I've set aside, so my first tip is Google Slides. That's how you make them. The next step, if you want to know, is I have block time scheduled for me to record videos, because I used to try to record videos in between patients, but I always got interrupted by my staff. And then what I found out is that if I didn't have any blocked time, I would never really consistently do it. And if you're into producing content, whether it be like an email for your patient newsletter, or a video, or a blog, you really need to do one piece of content every week. That's the key, is one piece of content a week. And to do it consistently, you really need block time. What that means, it's kind of like your surgical block time. You have block time that you're going to do something. So I put it in my schedule, Tuesday from 12:30 to 1. That's the time I record these videos. And so I have the whole week to prepare a couple of slides. I write down some notes, and once those are done, I'm all ready for Tuesday. And so when that time comes around, I just open up the slide, and I might add a couple of other images. I do full screen. I show the slide deck. I open up Zoom, and I record my videos and then the rest of the process I kind of pass off to my virtual assistant, or you could do it yourself. But basically, if you take that time and you have a system of getting the content, and there's always different content for you to produce, especially if you just think of different things you're seeing in your practice. If you want to talk about podiatry, you can also take questions that patients have. So, for example, I had a patient ask me, did my shoes cause my ingrown toenail? And these are questions, like if one patient is asking you this question, there are probably literally thousands of patients wanting to know the answer. So you can put your question there. Do shoes cause ingrown toenails? And you can do a couple of slides or a couple of images and talk about that. So that, in my opinion, is the easiest way to produce content using Google Slides. I am going to put some other resources. If you want to see my other slides, if you go to www.patientpresentations.com, those are the slides that I use in the treatment room, and from those I actually record my videos. And a lot of times I'll steal from those slide decks as I'm explaining another topic. So I have this like reservoir of slides. So it's real easy to produce them. They're not great quality. I get most of my images from Google. I just Google the idea, and then I steal the pictures and I put them in there, and I make my videos for them. So I haven't got caught for plagiarism or anything like that yet, but that's kind of how I do it. That's my process. Once again, if you guys enjoyed this, let me know. If you have any other questions, email me at don@podiatrypracticemastery. So that's the best tip I have for making content.